Thank you for joining us today on the Quad Cities COVID-19 press briefing. It is Tuesday, July 7th, and today we have with us Ed Rivers with the Scott County Health Department. We also have Nita Ludwig with the Rock Island County Health Department. Both of them will have prepared statements to share with you, and we will go to the chat after that for any questions that our media partners may have. First, Nita, we'll go ahead and ask you to share the case numbers for Rock Island County, and we'll ask for the same from Ed prior to hearing both of your prepared statements.
Good afternoon. In Rock Island County today, we are reporting 11 new COVID-19 cases, and that brings our total to 1,097 cases for Rock Island County. Our death toll remains at 30 for the county. We do have our temporary testing site, the state-run testing site at the Quad City Expo Center. And to date, from June 29th until yesterday, July 6th, they have tested 1,726 people at our site there at the Expo Center. This site has been extended, as I put out the press release yesterday, and they will be doing testing there through Sunday, July 12th, 8:30 a.m. to 4:30 p.m. Thank you.
In Scott County, the number published by the Iowa Department of Public Health on coronavirus.iowa.gov is 825, and our deaths remain at 10.
Okay, please go ahead, Nita.
The Quad Cities is now entering the third week of our increase in COVID-19 cases. And during the month of June, each county was averaging less than 6 or 7 COVID-19 cases daily. We are now experiencing daily totals of upwards of 22 in Rock Island County and 40 to 45 in Scott County. This trend is very serious. The trend is also dangerous, and this trend does not appear to be ending anytime soon. While a majority of our recent cases have been younger individuals, those around age 30 or under, we don't expect this to be the case long term. As we know, younger individuals socialize with friends, visit their family members, including grandparents and other older relatives, and work in a variety of settings, including restaurants and other hospitality settings that are frequented by individuals of all ages. While illness for young individuals is often less severe, it doesn't mean they are not at risk of getting serious illness or complications. Additionally, those who may not show symptoms of COVID-19 could unknowingly be spreading it to any of those individuals that I just mentioned, individuals who are more at risk for more serious illness and complications. This unintentional spread is becoming very real as our case numbers continue to rise. A natural consequence of the surge of positive COVID-19 cases is an increase in hospitalizations. This typically happens 8 to 10 days after an increase in cases, and we fully expect this to be the case in our community. A natural consequence of that is that rise in hospitalizations is the potential for COVID-19 related deaths. The public health and healthcare communities are doing everything possible so that we can prevent both of those outcomes. Thank you.
Ed, can you unmute yourself, please?
Can you hear me now?
Yes, we can.
Great, because we need your help now more than ever. Here are simple things you can do to protect those most vulnerable in our community. Make careful decisions when you go out. It'd be great to get together with your former college crew at a popular restaurant dinner, and it's annoying to have to cancel these types of gatherings if you can't social distance, but cancel them anyway. Think carefully about who you put at risk. Grandparents, family members, or friends with health conditions like asthma are all more likely to get seriously ill if the virus spreads to them. Wear a face covering to reduce the likelihood that you will unknowingly spread the virus to others. Wearing a mask is inconvenient, and it's not 100% effective at keeping you from spreading the illness if you're sick and don't know it. But studies show that it's safer than not wearing one. So wear one anyway. Stay home if you've been told you're a contact to a positive COVID-19 case. It's inconvenient to stay home even if you don't have symptoms. 14 days is a long time to stay home when you feel like your normal, healthy self. Stay home anyway. You could be saving the life of someone else who might not survive if they get the virus from you. We've never asked our community to do these types of things before, but then again, we haven't been in this type of pandemic before. You must make the hard decisions. There's no other way around the situation we are in. Please do your part to help stop the spread of this virus.
Thank you to both Nita and Ed for sharing this information. As local public health departments, we felt it was imperative to make sure that we continue to get on here and share these messages as we continue to see these increasing cases in our community. And we're really hoping you can help us spread the word on these different ways that we are needing the community to respond at this time. Please, if you have any questions for Ed and Nita, type them into the chat now. So we'll give it a minute and see if we have any questions beyond what was prepared in their statements. Nita, we do have a question here for you in regards to the woman in her 90s who died from COVID-19 that was released earlier this week. Do you have information on why she was isolating at home and not taken to a hospital?
Sure. I think a lot of people do get confused about the isolating at home, and really that just means that they weren't ill enough at the time to be in the hospital. So many people are isolating at home, and the home might be a correctional center, it might be a nursing home, it might be a private home. So we really can't divulge any other information other than that due to privacy reasons.
One other note that we wanted to share, as Nita mentioned, the community-based testing in Rock Island County continues, it sounds like till the end of this week, and that is for Illinois residents. So any Iowa residents that are looking for testing through a community-based site as that should log on to testiowa.com. And from there, they will be answering a series of questions. It's an assessment that will then determine the appointments that are available through those slots. And so any Iowa residents should look to be getting tested through Test Iowa versus the site that is open right now in Rock Island County. Okay, seeing no additional questions, we'll go ahead and conclude today's briefing. As always, a recording of this will be posted on the scottcountyiowa.com website, and we will be following up with a press release with some of the information as well as the number of cases that was shared on today's call. Thank you all for joining us, and we'll be talking with you again in the upcoming days.